Hello to all my wonderful 8th District constituents out there. It's Jayne Raskin coming to you on Facebook Live with 4 of my favorite people on a very serious and important subject. We are looking today at the COVID-19 crisis and the injuries of race, class, and inequality. So let me introduce who's here with me today. I've got 2 wonderful colleagues from Congress, Congresswoman Barbara Lee, who is certainly no stranger to any of you out there. She represents the 13th District in California. She's on the Budget and Appropriations Committee, and she's the co-chair of our Policy and Steering Committee. She's been the head of the Progressive Caucus. She's been the chair of the Black Caucus, and she's really been on the front lines of arguing for a popular response to the nightmare of COVID-19. Also joining us is my colleague, Congresswoman Grace Meng, who represents the 6th District in New York. She's on the House Appropriations Committee. She's on the Ethics Committee. She's the first and she's the only Asian American member of Congress from New York State. And she's the vice chair of the Congressional Asian Pacific American Caucus, which I am a member of. And she's had a long career as a public interest lawyer and also a New York State legislator. We're joined locally by Jayne Park, who you will know is the executive director of Impact Silver Spring since 2014, a group that is dedicated to confronting the root causes of racial and economic injustice. And she's been a leader in the civic community generally. Finally, we are joined by Maria Herrera, who's the executive director of Spanish-speaking community of Maryland, Inc., La Communidad, which is located in Frederick and in Silver Spring. Spanish-speaking community of Maryland has been helping low-income families and immigrants from diverse backgrounds for more than 40 years by promoting social change, education, and legal and political rights. Welcome to everybody. And let me start with the members of Congress, and perhaps we'll go first to Barbara and then to Grace. Why do you think COVID-19 has hit minority communities with such a brutal and disproportionate force?
First, Jamie, let me thank you. Great to see you, and great to see Maria, Jayne, and Grace, and to all of your constituents. Let me just say thank you. First of all, I just have to say to Jamie, Jamie knows my history with his family. I knew his dad with IPS Marcus. He was a dear friend since the 70s. Wow. And Jamie, we miss your dad tremendously. But what you're doing in Congress, I know he would be proud, and I know he's guiding your way. So you're doing such a great job, and your constituents are really, you know, they're very blessed to have you representing them on so many fronts. You know, first, let me just say thank you to our essential workers, our hospital workers, our letter carriers, grocery workers, everyone on the front line who really are looking out for the health and safety of all of the country. And so we have to take a moment always to salute them and thank them. Many of them, large numbers, are disproportionately people of color, Black and brown individuals. They're on the front lines. They're in states that are insisting to open up without regard to the health concerns. And they oftentimes are low-wage workers, are being forced back to work in very dire circumstances where they risk their health, the health of their families, and their communities. And so it's outrageous how that fact alone is impacting disproportionately the Black, Latinx, and AAPI communities and Native American communities. Secondly, let me just say with regard to COVID-19 and the health issues specifically, we know, and we can't focus right now on the underlying conditions, but we know for a fact, and I co-chair with Congresswoman Judy Chu, the KPAC's Health Task Force. So we know the underlying conditions in terms of health disparities based on race and ethnicity. COVID-19 is disproportionately impacting and hitting people with these underlying health conditions. But that goes even deeper. So we have to understand that this is an emergency in communities of color. It's about life and death, and we have to address it in a big way, in a targeted way, with rapid testing, contact tracers who reflect the community based on culture, based on linguistic background, based on all of the issues we know. Okay. But these underlying conditions, let's say, go right to the social determinants of healthcare. And when you have a country, now I'm speaking now as an African American, 400 years since the Middle Passage, since slavery, since enslaved people helped build this country, we have systemic racism, institutional racism, structural racism embedded in the policies of this country. You cannot deny that. And so now what the rest of the country and the world is seeing, what we've been saying since the beginning of time. And that is racism is alive and well in America. And until you deal with these structural issues, my friends, a lot of my white liberal friends are saying, Barbara, how can this be the case? What's going on? I'm saying, you guys have forgotten. We have not dealt with racism, and we have not dealt with hate, and we have not dealt with xenophobia. We have not dealt with all of the historical reasons that give rise now to the underlying health conditions that give rise now to the disproportionate transmission of the virus and death. And so we have to deal with the emergency right now. But let me tell you, we don't want to go back to normal, Jamie. We have got to move forward and develop a movement based on racial, gender, and economic equity. It just can't be about economic equity. It's got to be about racial and gender and economic equity. And I think COVID-19 is showing that.
Barbara, that's so powerful. I want to thank you for everything you said. Let me just remind everybody, please mute your phones when you're not talking so we don't get the background noise. We want to hear what everybody is saying. That was so powerful. Congresswoman Lee, Grace, just pointed to a number of factors. She talked about where people are working and how so many people in minority communities are on the front lines themselves. She talked about underlying health conditions that people are struggling with, but she also talked about the sharp inequalities of access to healthcare and to economic benefits that are being exposed by this crisis. Tell us how these factors and other factors are manifesting in your district in New York, which has been one of the hardest hit places in America.
Sure. I too want to say thank you to Jayne Raskin for having me and our leader, Barbara Lee, on today. Jamie, when your office asked, I said yes right away. No other reason other than we like you. You have a big heart, and I mean this positively, big brains. And we think your district and our Congress is so blessed to have you. So this is easy for us. What Barbara said is true, and you can see how this manifested itself in diverse communities from the very beginning. So when in New York and in New York City, when we were all getting warnings to, safely stay at home, quarantine, first of all, a lot of our constituents in minority communities were not able to safely quarantine at home. They might live in a very crowded space. They might not live with their immediate families. They might be essential workers, and they might not be able to safely quarantine. And therefore, we saw, especially in my district in Queens, which is probably the hardest hit in New York City, people were getting sick, and there was literally nothing that could be done. And top of that, a lot of the information that was coming out straight from the CDC to even local resources, which are coming out a little slower in other languages, people are busy working. They might not be fluent in English. They weren't getting even the adequate information and warnings that maybe the rest of us could access more easily. And so what you saw with most of the people that passed away in Queens, New York, most of them had underlying conditions like what Barbara mentioned. And that goes to why we should do things like make sure we're filling out the census, because I think had my borough, for example, county, filled out the census more accurately, maybe we'd have more hospital beds, maybe we'd have more healthcare centers where these conditions could have been taken care of much earlier on.
Terrific. Thank you for those insights. I want to turn to Jayne and Maria now. As you listen to Congresswoman Meng, you listen to Congresswoman Lee, how do you interpret what they're saying in terms of what you're seeing in our local communities here in Maryland's 8th District, in Montgomery and in Frederick? And Jayne, perhaps we start with you.
Yes, thank you so much, Jamie. And like everyone has said, the minute Jamie asked me to do this, I said, of course. We're just so blessed to have him representing us. And consistent with everything that's been said, for us, this pandemic has exposed the disparities that have always been here. And so most of the folks that we work with in the Impact Network are largely low-income immigrant communities throughout Silver Spring and Montgomery County, many of whom are undocumented. A lot of these folks are working in industries that were hardest hit by the pandemic, such as restaurant workers, childcare workers, house cleaners. They were barely getting by paycheck to paycheck before this pandemic hit. Now we're finding there are so many people who are out of work with no income coming in and no safety net. Many of these folks do not qualify for unemployment benefits. They don't qualify for the federal stimulus money. So there is no money coming into these households. And the other thing that it's exposed that, again, we always knew to be true are the overcrowded housing conditions that Representative Meng mentioned. Many of these families are living multiple families in a small apartment space with no health insurance, no doctors, no access to health care. So these disparities were already there. People were struggling to survive, and this pandemic has literally created unprecedented crisis. And our small team has been working 24/7 trying to figure out how to weave together some semblance of a safety net. And so some of what we've been doing is really pushing both for philanthropy and our local county government to put in place some emergency cash relief assistance. Because again, these are families who are not getting any unemployment insurance or federal stimulus. So the need for cash assistance is critical. And the other thing and so we've managed to get some things in place and have actually ourselves through some philanthropic dollars been giving out immediate cash assistance to families.
Impact Silver Spring has been doing that.
Drop in the bucket. I am telling you, I just got off a staff call with the limited funds we have, trying to decide who in our network was in more crisis. And it was the most heartbreaking conversation. So it's rough. And the other thing that we're finding is that a lot of these families who don't have access to healthcare, they're symptomatic of COVID. And so we've been working with the county to get ready emergency responders to actually go into apartments and homes to do COVID testing, screening, and treatment. And we've been trying to work out the kinks with the county around this. It hasn't been all smooth, but the bottom line is these are communities that cannot access COVID testing, screening, and treatment. And I mean, one of the things that we're finding that I think this crisis has also revealed is how siloed and fragmented our social service system is. Families are given like 10 different phone numbers to call.
Yeah.
And they've got myriad of needs, cash assistance, health, food. And the last thing they need to be given are 10 different phone numbers to call. So we are also really trying to work with our county government partners to figure out how to develop a more coordinated response. So I think, so the bottom line for me is that the crisis, the pandemic has really revealed, again, the truth of the disparities and the truth that our systems there's a lot of need for improvement.
Yeah. Well, look, thank you very much for everything you're doing. Let me go to Maria. And Maria, we've just learned from, my other three panelists that the COVID-19 has exposed pre-existing inequalities and injustices, but it has exacerbated those inequalities and injustices too. Would tell us what you're working on to try to confront the crisis through your organization.
So one of the things, Jayne, and thank you and good afternoon to everyone. One of the things that we have been working on is, helping people fill out medical applications and encouraging individuals to seek medical assistance if not feeling well. I mean, part of the healthcare crisis, as we all know, many international families go without medical care, and it's due to cost, ineligibility, or fear factor. I think the fear factor is one thing that it's really taking I think it's coming even more out with our families. People are afraid that if they actually tried some type of assistance, due to the public charge that was approved, if you remember, for public benefits, that can lead to grounds for inadmissibility when applying for immigration status.
Yeah.
So a lot of these, so there's a lot of confusion regarding this topic, and people sometimes don't know that they can apply to certain things and not be liable in the later times. So unfortunately, these types of fear factors and ineligibility and cost has really triggered a medical crisis, because it's leading to undiagnosed illnesses. The multifamily environment that was mentioned is also very concerning, because people are not seeking COVID testing, and they're spreading the virus more easily through the multifamily situations. And also another concern that I had was that a couple of clients that called and said that several weeks ago they had paid over $200 to get COVID testing. So for someone who doesn't have employment and doesn't have anything like this, they're going to shy away from getting the proper testing that they need to get done. Sort of to echo some of that, I agree with what has been said, inability to secure much needed form of relief. The I-10 individuals who are not receiving any type of relief. So consequently, they're left with nothing in terms of being able to pay their bills. Employment, I have a client, for example, who has had 2 bouts of cancer, just finished chemotherapy. She had to go work because she had no other choice. And then they sent her home because one of the colleagues had COVID. So you can imagine what this would have cost her with this types of treatments. So what we're trying to do as best as we can. Another thing that we're also seeing now is on the employment side, we're also seeing more people being forced to work more with less wages, and or not getting paid for all their time, or letting go if in the event that someone may be sick and may be out. So what we're doing from our side is, again, filling out medical applications, encouraging individuals to seek medical assistance when not feeling well, filling out social services applications, delivering gift cards, which in Frederick has been given to us through the generosity of the Osherman Foundation, making wellness checks to call families to better understand what their needs are. One thing that we've also done is created a video set that is published every Saturday. We've worked with therapists who can provide ideas on how to reduce stress and other topics. And a new video, as I said, is posted on every Saturday, and we encourage people to take a look at those.
Well, thank you for everything that you're doing for all of my constituents in Frederick County and in Montgomery County. And thank you, Jayne. I want to invite my colleagues from Congress who joined us to close us out by talking about the future for a minute, how we can parlay this crisis into something positive in terms of all of the focus on these issues that were buried for so long. How can we turn it into something positive? And Grace, let me start with you. And I think Congresswoman Lee is struggling to get back on the call. If you can help her, Josie, get back on the call. But Grace, if you would opine on that.
Sure. Well, I think that the HEROES Act that we just passed in the House is a tremendous first step. I was proud of what we had passed up until the HEROES Act, but truth be told, it wasn't enough. Whether it was the small business loans or the cash rebates or the unemployment, I still was hearing from the same types of constituents that they weren't getting help of any sorts from the federal government. So as we partner with allies like Jayne and Maria, and with city, county, local governments, we just need to make sure we are continuing that support. Even in New York, when our pause ends, people are not going to feel comfortable going back out. I'm especially concerned with the lack of food accessibility, that a lot of families who've lost their jobs, who are waiting for the HEROES Act to be signed into law, and who might be senior citizens who are still scared to go out. We are going to have to sort of rethink how we are taking care of people. And I think number one, and Barbara's done tremendous work on this in her career, food accessibility. How do we connect the dots from, we're hearing at the same time, our colleagues from more rural areas where farms can't get rid of their food, they're dumping milk. to the restaurants that don't have business because no one's purchasing their food. Well, we need to figure out ways, just in terms of food, how to connect them with the people more efficiently, with the people who actually need them. So going forward, I would say, food and housing is crucial, and making sure that the HEROES Act is signed into law so we can get people the help they need.
Thank you, Grace. And the final word will go to you, Barbara Lee. The Great Depression led to the New Deal. The Civil War led to Reconstruction. Is there a way that we can take this terrible pandemic where every system is in crisis, as Grace Meng was just saying, and turn it into something positive? And does the HEROES Act begin to show a direction?
Sure. Can you hear me now, Jayne?
We got you.
Okay, thank you. Sure, and I'm glad Grace raised all of these issues in terms of what we have to do to move forward. And let me just add to that, because right now, a couple of things. We have to make sure, and I support Medicare for all, that we have a healthcare system that is not based, I don't believe, on strictly employer-based, because we see now so many people losing their healthcare. So we've got to get out of this with a better healthcare system. And we have to also get out of this, as a member of the Appropriations Committee, along with Grace, we see how these budgets are being just decimated by the Trump administration as it relates to the offices of minority health, offices of racial and ethnic disparities, and strategies to begin to address the social determinants and the underlying causes of health disparities. And so we have to have both a focus on health impacts as well as economic impacts for communities of color, for low-income communities. And I work with Bishop Barber on, so do you, and Grace and all of us on the Poor People's Campaign. And we've got to make sure that low-income people and poor people never return to the normal that they experienced before this, living on the edge. And so we have to make sure that not only do they survive during this pandemic, but that they thrive moving forward and never go back to the normal that they knew in terms of low wages, no health care, indecent housing, living on as unsheltered people. I mean, it's outrageous. And so we better see this as a time to redo some of our structure in this country and some of our policies that have to be reordered. And finally, Jamie, let me just say, I got to put a pitch in for a bill I'm going to introduce next week. I think Grace is a co-author, but you ain't going to look at it. And, in South Africa and in Rwanda and other places around the world, they had truth and reconciliation commissions. Well, I think it's time, and for the last 3 years, I've been working with some great academics, some from Maryland, with Tom Perriello from Virginia, with Jerry Connolly and others, to introduce a legislation or resolution setting up a commission for truth, racial healing, and transformation. We decided not to put in reconciliation because there's nothing to reconcile, but we're looking at the Middle Passage, the vestiges of the Middle Passages. We're looking at the Chinese Exclusion Act. We're looking at what happened with the Native American community, with the Japanese internment, all of the issues that have never been reconciled in America. We think now, and again, 3 years we've been working on this. We're introducing it next week because now's the time, given what's being exposed, for truth telling. And I think it was Jayne who mentioned we got to tell the truth. And so we're rolling this out as just part of a package now for the future, because next week we're going to hit the press very hard on why it's important that the rest of the country understand the truth with regard to why people of color and low-income people are bearing the brunt of this horrible, terrible, deadly pandemic.
Well, we're giving you a standing ovation from our basements, Barbara Lee, and you too, Grace Meng and Maria Herrera and Jayne Park. All of you are so inspiring. I would love to be an original co-sponsor of that legislation, Barbara, so please put me down as quickly as you can. I want to be part of that. I want to be part of the American Truth and Justice and Transformation Commission. That makes a lot of sense to me. Thanks to all of you. Stay strong, stay healthy, hang tough, and we're going to get through this crisis, and we're going to be stronger than we ever were when we do. Thank you so much for joining me.
Thank you so much.
Thank you very much for having us. Bye-bye.
Thank you.
Bye-bye.